And as it pertains to the staff motion, specifically the research on care courts and mental health and substance use disorder treatments in Minneapolis. I'm going to be voting yes on this item because I believe that any opportunities that the council has to be informed about, subject matter, especially related to this committee work, is always great. And conversations about policy should be talked about and debated in the public. So again, I look forward to the information related to this item coming back to committee for further conversation. However, I do want to emphasize that I have deep concerns around coerced approaches to treatment. It was noted in the preliminary assessment memo attached to the LIMS file that the policy and research team compiled that the ACLU and disability rights groups are vocal in their opposition to California's new care courts legislation and policies. So I don't think we should be taking that lightly as we have this conversation, and I don't want anyone in the public to misconstrue my vote today as being taken as affirmative of any type of coercive treatment measures that we are possibly looking to pursue here at the city, or some council members are looking to pursue here at the city. So I just wanted to name that and give clarity. So just wanted to share those things.
I also want to acknowledge the presence of Councilmember Ellison for the record. And next, I'll give it up to Councilmember Rainville.
Thank you. I do want to speak to item number 2, and I'm the council member who is advancing this. So I do want to be transparent and say this is coming from me, and I appreciate the help and support I've gotten so far from Council President Payne, because we have talked about this for well over a year, and I think this is just another piece of information that we need as we go forward. As I looked down the dais, there was actually 4 of us who were at the meeting over at the Native American Center yesterday to talk about the crisis we're having with homeless, and the subject of addiction and mental health came up time and time again. And I appreciate the vote from Councilmember Wansley, although she might not agree with what she feels is the intent, and I would ask to keep an open mind. But I want to leave with what came up yesterday, which was the question, which has no answer so far, is how do you help someone who will not help themselves? Thank you.
Thank you. Next up is myself. I just want to make a few comments about item number 2. I'll begin by saying that I think the second component, which is assessing the degree to which mental health and substance use disorder treatment are accessible in Minneapolis for residents experiencing homelessness, is something that is very interesting to me. So I'll be supporting, while I don't support the entirety of this legislative directive, I do support that second component, which talks about the mental health services that are available in the city, which I think aren't as much as we deserve and need for our unsheltered residents. Now, when it comes to the forced coercion of unhoused residents in California's law, that is not something that I support. So I just want to make sure that any residents that are watching this today, me voting in favor of this is just getting more information because I think learning about this is important. However, I do not support the practice of forced coercion or the work that California is doing when it comes to this particular topic with care courts. I just want to be very clear on that component. So I do want to thank Councilmember Rainbow for bringing this forward, particularly the second bullet point, which I think is something that would be beneficial regardless of what policy is moved forward or not. With that, I'll pass it on to Council President Payne.
Thank you, Chair Chavez. I want to thank Councilmember Rainville for bringing this forward. As he mentioned, we've been discussing this for over a year. I, too, express some reservations about coercion, and I'll also echo the sentiment that the more information that we have on this topic, the better. And just as we move forward, I'm just really curious to see what other jurisdictions are doing. I read in the New York Times, for instance, that LA was meeting people where they are, and they were actually doing medication with folks that were living unsheltered, but they were doing an injection. And as we just saw in our consent decree that we just approved, MPD has a history of injecting folks with sedatives against their will, and that was somewhat of a bombshell report when that came out several years ago. And so we need to tread lightly and sensitively on this topic, but we also need to acknowledge the real need in the community. And I think, like, to Chair Chavez's point, the real issue is we don't have enough facilities for folks. We don't have enough treatment options for folks. It's my belief that when we have culturally appropriate treatment options, people will actually want to pursue that support. And so we have to balance the fact that sometimes maybe people are hesitant to enter into the treatment that's available to them. That doesn't always mean that they're refusing treatment. Sometimes just the treatment that best fits their needs isn't available. And so I'm excited about what our policy and research team is going to unearth when it comes to this topic, because this is really one of the most complex topics we're facing as a city. So I'll be supporting this today with all of the same caveats that I think some of the other folks up here have expressed.
All right, no one else is on cue. So on the motion to approve items 1 through 4, all those in favor say aye. Aye. Those opposed say nay. That carries, and the consent agenda is approved.